Hi, this video will teach you how to administer insulin with a Flexpen. Insulin is a drug often used by diabetics. Follow these instructions to properly administer your insulin via a Flexpen. First, wash and dry your hands thoroughly. Proceed to check the pen label to make sure that the pen contains the right type of insulin for you and that the insulin in the pen is not expired. Then remove the cap of the pen. If you are using a cloudy suspension insulin, roll the pen between your palms 10 times or until the solution in the pen is consistently cloudy throughout. Do not shake. Use an alcohol swab to clean the rubber membrane of the pen. Tear off the paper tab of a new needle. Then screw the needle straight and tightly onto the Flexpen. Remove the big outer needle cap and keep it for later. Also remove the inner needle cap and throw it away. Turn the dose selector to 2 units. Hold your Flexpen with the needle facing upwards and gently tap the cartridge so that any air bubbles gather at the top. Then press the push button all the way in. A drop of insulin should appear at the tip of the needle, and the dose selector will return to 0. If a drop of insulin does not appear at the tip of the needle, turn the dose selector to 2 units. Hold the Flexpen with the needle facing upwards. Gently tap the cartridge and press the push button. If a drop of insulin still does not appear at the tip of the needle, you may consider changing a needle. Before turning the dose selector to 2 units, holding the Flexpen with the needle facing upwards, gently tapping the cartridge, and pressing the push button. If a drop of insulin still does not appear at the tip of the needle, your Flexpen is likely to be faulty. After ensuring that your Flexpen is in working condition, use an alcohol swab to clean the injection site on the abdomen and let it dry. The injection site should always be 3 fingers away from the belly button. Turn the dose selector of a Flexpen to the number of units of insulin that you should be taking. Hinge the fat at the injection site and insert the needle in at a 90-degree angle. Press the push button until the dose selector returns to 0. Keep the push button depressed and count at least 6 seconds. Keeping the push button depressed, remove the needle from the skin. Then release the push button. Remember to alternate injection sites. Other possible injection sites include your thighs, upper arms, and buttocks. To dispose of the needle, place the big outer needle cap carefully onto the needle without touching the needle. After ensuring that the needle is completely covered, completely push on the big outer needle cap and twist off the needle. Dispose of the needle into a puncture-proof container. Your Flexpen should always be stored without the needle attached. Otherwise, insulin may leak out resulting in inaccurate dosing. After a Flexpen has been opened, do not refrigerate. Instead, store it at room temperature, away from direct heat and sunlight. You have now successfully administered insulin.
If you have any further questions or are unsure, please consult a healthcare professional.
Thank you for watching this NUH production. Take care.